CEN test prep exam free response. Question 1. The most effective method to control severe bleeding from an extremity wound is: Option A, elevation. Option B, direct pressure. Option C, pressure point compression. Option D, ice application. The correct answer is option B, direct pressure. Question 2. CIRS, systemic inflammatory response syndrome, criteria include all of the following except: Option A, heart rate greater than 90 bpm. Option B, respiratory rate greater than 20 or PACO 232 mmHg. Option C, temperature 38 degrees C or 36 degrees Celsius. Option D, elevated troponin. The correct answer is option D, elevated troponin. Question 3. A patient presents with cholinergic symptoms: salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis. This toxidrome is most likely caused by: Option A, anticholinergics. Option B, sympathomimetics. Option C, cholinergics, organophosphates. Option D, opioids. The correct answer is option C, cholinergics, organophosphates. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient with an acute myocardial infarction develops a new holosystolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A, a ventricular septal rupture. Option B, papillary muscle rupture with mitral regurgitation. Option C, pericarditis. Option D, aortic dissection. The correct answer is option B, papillary muscle rupture with mitral regurgitation. Question 5. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, the immediate endotracheal intubation. Option D, a neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. Question 6. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: Option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C, irrigate the bladder with normal saline. Option D, prepare for suprapubic catheter. The correct answer is option B, perform a retrograde urethrogram before catheter insertion. Question 7. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is: Option A, forcing oral fluids. Option B, straining all urine. Option C, pain management. Option D, surgical consultation. The correct answer is option C, pain management. Question 8. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A, hypovolemic shock. Option B, distributive shock. Option C, cardiogenic shock. Option D, neurogenic shock. The correct answer is option C, cardiogenic shock. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PACO 258, PAU 262, HCO 324. This represents: Option A, uncompensated respiratory acidosis. Option B, compensated respiratory acidosis. Option C, uncompensated metabolic acidosis. Option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. Question 10. The emergency nurse suspects acute epiglottitis in a patient presenting with: Option A, inspiratory stridor, drooling, and tripod positioning. Option B, barking cough, low-grade fever, and hoarseness. Option C, productive cough, pleuritic chest pain, and fever. Option D, a wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A, inspiratory stridor, drooling, and tripod positioning. Question 11. To calculate cerebral perfusion pressure, CPP, the nurse needs to know: option A, heart rate and blood pressure; option B, mean arterial pressure, MAP, and intracranial pressure, ICP; option C, respiratory rate and oxygen saturation; option D is central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Question 12. A patient leaving against medical advice, AMA, must be informed of: option A, they cannot ever return to this hospital; option B, their bill will be sent to collections; option C, the risks and potential consequences of leaving; option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. Question 13. Which finding is consistent with an anterior shoulder dislocation? Option A, arm held in internal rotation and adduction; option B, arm held in external rotation and slight abduction; option C, patient unable to flex the elbow; option D, numbness of the medial forearm. The correct answer is option B, arm held in external rotation and slight abduction. Question 14. The best method to remove a prosthetic eye in an emergency is: option A, using forceps to grasp the prosthetic; option B, applying suction with a bulb syringe; option C, using a suction cup designed for prosthesis removal; option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. Question 15. Priapism is a urological emergency characterized by: option A, painful, prolonged erection; option B, inability to void; option C, testicular torsion; option D, a scrotal edema. The correct answer is option A, painful, prolonged erection. Question 16. Which pupil finding is associated with uncal herniation? Option A, pinpoint, non-reactive pupils; option B, a unilaterally dilated and fixed pupil; option C, bilateral mid- position and fixed pupils; option D, a constricted, sluggishly reactive pupils. The correct answer is option B, a unilaterally dilated and fixed pupil. Question 17. In a multiple minus casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is: option A, green, minor; option B, yellow, delayed; option C, red, immediate; option D, black, deceased/expectant. The correct answer is option C, red, immediate. Question 18. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A, abdominal X-ray; option B, abdominal ultrasound; option C, CT scan of the abdomen; option D, a complete blood count. The correct answer is option C, CT scan of the abdomen. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A, restrain the patient firmly; option B, insert a bite block; option C, maintain airway and administer benzodiazepines as ordered; option D, obtain a stat CT scan. The correct answer is option C, maintain airway and administer benzodiazepines as ordered. Question 20. The safe harbor provision for nurses typically refers to: option A, a law that provides legal immunity in all circumstances; option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation; option C, a hospital policy allowing nurses to refuse any assignment; option D, the requirement to report all medication errors. The correct answer is option B, A process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Question 21. Testicular torsion is a surgical emergency that requires intervention within option A 24 hours, option B 4-6 hours, option C 2-3 days, option D. It is not a surgical emergency. The correct answer is option B 4-6 hours. Question 22. Sengstaken minus Blakemore tube placement is used as a temporizing measure for bleeding from option A, peptic ulcer, option B, esophageal varices, option C, diverticulosis, option D, aortoenteric fistula. The correct answer is option B, esophageal varices. Question 23. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A, patch both eyes. Option B, immediate copious irrigation with water or normal saline. Option C, administer topical antibiotic drops. Option D, perform a visual acuity test. The correct answer is option B, immediate copious irrigation with water or normal saline. Question 24. Meningitis is an inflammation of the option A, a brain parenchyma. Option B, meninges covering the brain and spinal cord. Option C, peripheral nerves. Option D, a ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Question 25. Necrotizing fasciitis requires what priority treatment? Option A, broad spectrum antibiotics alone. Option B, immediate surgical debridement. Option C, hyperbaric oxygen therapy. Option D, wound vac placement. The correct answer is option B, immediate surgical debridement.